This is the first chapter of pathophysiology. So we're going to start talking about some of the terminology involved with pathophysiology. And we'll take a look first of all of what pathophysiology is involved with, and it's a study of the disease process. And a disease is a significant change or changes that occur in the body. They could lead to a state in which homeostasis cannot be maintained. So when we talk about homeostatic imbalances, we're usually referring to a disease state. And that word homeostasis is defined as a constant or steady state. And there's some things that we've talked about in anatomy and physiology that have a range that's acceptable. Things like blood pressure, body temperature, fluid and electrolyte balance, blood pH. Remember, we mentioned blood pH being 7.35 to 7.45. So as long as you're within this acceptable range, then it's okay. But when you fall outside this range, you upset the homeostatic imbalance and balance, and that could lead to a disease process. So pathophysiology, we're looking at functional or physiologic, because remember, physiology refers to function, these changes in the body that result from this disease process. So it does include some aspects of pathology. Pathology is the study of diseases, and you can look at laboratory studies of cell and tissue changes associated with this particular disease. So now we're going to go through a lot of terms because this will get us started and put us in the right place as far as clinical words that are used to talk about pathophysiology. Now the term biopsy, if you've ever heard of anybody having a biopsy, they take a surgical specimen, they'll take a look at tissues, they'll bring it down to the lab, and the pathologist will analyze the tissue and look at it. The histologist will prepare slides, and you're looking at things that possibly could be maybe cancer, changes in tissue that could lead to a cancerous condition, atypical cells maybe associated with a pap smear, something like that. Autopsy is pretty extensive, and you're looking at tissue samples throughout the entire body, various organs, looking to see what the causative agent of death was, or possibly could lead to maybe things going on in the body that the family may want to know about that could predispose some of them maybe to possible situations in their lives. So autopsy, pretty intensive procedure. Now, some other terms. Diagnosis refers to the identification of a specific disease through evaluation of signs and symptoms, as well as lab tests or other tools to figure out what is going on with that particular patient. Etiology. This concerns the causative factors in a particular disease. And it could be many things that cause it. It could be congenital defects, something that you inherit, or genetic disorders. Could be a microbe, could be a virus or a bacteria, an immune problem, metabolic derangements, degenerative changes, malignancy, could be burns or other trauma, and could possibly be something like a nutritional deficiency that could lead to a disease state. Idiopathic refers to disease of an unknown cause. Iatrogenic, a treatment or procedure or an error that may cause a disease. A person that has a catheter in the hospital might be exposed to microbes that could lead to a bladder infection. Or you could have a bone marrow damage due to a prescribed drug. So these are iatrogenic. Predisposing factors encompass the tendencies that promote development of a disease in an individual. Prevention, ways that you can help yourself from having some type of a disease process, like vaccinations, dietary or lifestyle modifications, stopping harmful activities like smoking, alcohol, certain drugs, exercising to help with keeping yourself in shape. Now we go to something like pathogenesis. So these are characteristics of a particular disease, and pathogenesis refers to the course of the disease. Now, onset, you can kind of break this out a little bit because the onset could be acute, which is sudden or obvious, like gastroenteritis, or it could be insidious, with a gradual progression that has very little sign, like hepatitis, some cancers that you don't really know you have them until they're very far progressed. And then there's chronic. Chronic is a milder condition like, say, rheumatoid arthritis, but persists for a very long time, or something like MS. So onset breaks out to acute, insidious, and chronic. Now, subclinical state, pathological changes occur, but no obvious manifestations are exhibited by the patient, so we usually say at this point, really can't be diagnosed. Now, the latent or silent stage, no clinical signs are evident. This is the incubation period, where maybe the microbe is replicating the virus or whatever it is that you're infected by, and it could be a few days or it could be weeks. Now, the prodromal period is a time of early development of the disease. You're aware that something's going on, but the signs are not specific yet. Like you might feel fatigued or have loss of appetite or a headache, but really can't pinpoint what's going on. You just don't feel right. Now, manifestations include the clinical evidence or effects. So this is a collection of things like the signs, the symptoms of the disease. Could be local, could be at the site of the problem, or systemic, like a fever. Now, signs are obvious indicators of disease that are obvious to someone other than the affected individual. So if somebody has a fever and they look kind of reddish in color, or if they have a skin rash. And symptoms are subjective feelings like pain and nausea. And if you put these two together, the signs and the symptoms, then that usually will give you something called a syndrome. That's a collection of signs and symptoms that usually occur together in response to a certain condition. Now, I've skipped lesion on purpose because signs and symptoms together go into syndrome. Lesion's kind of a separate thing, but that's a specific local change in the tissue. And a lesion could be microscopic, something you can't see with the naked eye that has to be observed under the microscope, or it could be visible, something that is macroscopic in nature. Then we go to diagnostic test. This is done in the lab. And the term remissions and exacerbations, those two terms kind of go together too many times. They mark the course or progress of a disease. And remission is when you don't really see the signs, the person's feeling pretty good, and things have kind of gone to rest for a while. And exacerbation is where you have a full-blown attack of that particular disease process. And where I see this quite often is in MS. MS has this cycling that occurs where the person will feel pretty good for a while, and then they have an exacerbation, and then they go into remission. And there's other diseases that do this as well, but this kind of is a cycling or a progression that occurs in some diseases. Precipitating factors these are conditions that can trigger an acute episode. Say, for instance, something like cold weather can make asthma a lot worse, or arthritis a lot worse. So that's precipitating factors. Complications, these are secondary or additional problems that arise after the original disease begins, like complications associated with pregnancies. Not everybody gets them, but some people have complications. Strep throat that leads possibly to rheumatic fever, something like that. Therapy is what the treatment is, the measures are that are used to promote recovery or to slow the progress of a disease. Sequelae, an interesting term. Sequelae refers to potential unwanted outcomes of the primary condition, like hepatitis leading to cancer, or some forms of papillomavirus infections leading to cervical cancer, or postpartum depression as a result of pregnancy. So these are sequelae. Convalescence, period of recovery and return to normal healthy state. And then we go to prognosis, and prognosis is the probability for recovery. Watch these terms. They have short definitions and they're close. Morbidity, disease rates within a group. Mortality, relative number of deaths from a particular disease. And epidemiology, the science of tracking the pattern or occurrence of disease. Epidemics, when there are many cases of an infectious disease within a given area. And if it's a pandemic, it involves very large regions or could be worldwide. Incidence refers to the number of new cases noted within a stated time period. And communicable diseases, diseases that can be passed from one person to another. And notifiable or reportable diseases, these cases must be submitted to designated authorities, such as HIV infections, and there are many others. Now we're going to go to changes in cells that are something you want to keep in mind. These are terms for changes, and they're called adaptations. Now, the word atrophy refers to a decrease in the size of the cells, like if something is in a cast, like if you have a limb that's in a cast, skeletal muscles tend to shrink when they're in a cast from non-use. That's a type of atrophy. Hypertrophy is an increase in the size of the cells. So if you train and you do weight training, you can increase the size of muscle cells. This is hypertrophy, not to be confused with hyperplasia. Hyperplasia is increase in number of cells, and it results in an enlarged tissue mass. So, for example, the uterus enlarges during pregnancy and could indicate cancer if it occurs in other tissues. Metaplasia, one mature cell type is replaced by a different mature cell type, and this happens quite a bit when you have fibrosis in tissue, or you have tissue like, say, for instance, in smokers, squamous epithelial lining of the respiratory tract is replaced. You might get a replacement of a type of epithelium that's not ciliated, not like the normal type of tissue that you find in the respiratory passageways. Dysplasia is tissue having cells that vary in size and shape with increased mitotic rate. So these are called atypical cells. They may result from chronic irritation or infection, or they could be precancerous changes. Routine pap smear checks for atypical cells in the inferior tip of the cervix. Now, anaplasia, these are cells that are undifferentiated and they have variable nuclei and cell structure. And anaplasia is associated with a malignancy or cancer and is the basis for grading a tumor. So remember, anaplasia is the basis for grading a tumor. The word neoplasm is a new growth, a tumor, and it could either be benign or it could be malignant. Ischemia is a term that refers to a lack of blood flow to a particular group of cells. And if you do not have blood flow to the cells, then they are deprived of oxygen. And if you don't have oxygen delivery to tissues, they cannot make ATP, because that's part of that formula where you have glucose plus oxygen and your end product is ATP. So the cells rely on ATP to carry out their metabolic processes, so insufficient oxygen interferes with cellular metabolism. And ischemia is the most common cause of cell injury. Now, there are three words associated with this. Necrosis is when a group of cells die. Okay, that's a generic term. Infarction is an area of dead cells resulting from lack of oxygen. Now, when a large enough area of cells die, you can have a loss of function. And connective tissue or scar tissue replaces the functional tissue, and this replacement tissue is not functional. Now, gangrene is when you have an area of necrotic tissue that's been invaded by bacteria. And gangrenous tissue frequently must be removed surgically, and in some cases, when it's progressed very far, amputation has to occur to prevent the spread of infection to other parts of the body. So 3 terms associated with death of tissue. 7 steps to health. I'll just read these to you, but these are things to be aware of for maintaining proper health. So don't smoke and avoid secondhand smoke. Maintain a healthy weight. Avoid excessive sun exposure. Get routine checkups. See your doctor and dentist regularly. Have unusual spots checked. Follow health and safety instructions when using hazardous materials. And that finishes up Chapter 1.